Good evening, everyone, and welcome to the Renaissance Center monthly chat where we discuss, hot topics that are relevant to the community for mental health, spiritual health. And so we are going to get right in. We welcome you again to the Renaissance Center chat. So this evening, before we get started, I want to let you know that the Renaissance Center is still offering free sessions, 2 free sessions for Baltimore City and Baltimore County residents. So if you could just call 410-409-0025, that would be great so that you can get the help that you need. So today for our special guest panelists, we have three people that are experts in their respective fields, and I'm going to let them introduce themselves, but I want to welcome Sister Imani Angela Rose to the RC chat, Dr. Lene Hamilton, and Pastor Walter Thomas Jr. So we are so grateful to have them with us this evening. So we're going to get right into it. So we'll start with Imani, Dr. Lene, and then Pastor Thomas, and you can introduce yourselves.
Good evening, everyone, and thank you, Lady Caller, for having me this evening. I am Imani Rose. I am a registered nurse. I've been a nurse for about 31 years. I specialize in pediatrics primarily, but I am also the Morning Star Baptist Church Health Ministry Liaison, so I oversee a lot of our health protocols and help manage how we make it through this pandemic. That's all I have.
Welcome, Imani.
Good evening, everyone. Absolute pleasure to be here with you tonight. I'm Dr. Lene Hamilton, and I am a licensed clinical psychologist serving our wonderful populations over in West Baltimore. Wonderful population there. And I'm also in private practice in Columbia, primarily providing services for psychological assessment and testing for individuals who are having problems with attention and focus. And so it's an absolute pleasure to be with you tonight.
Welcome.
Mm-hmm.
Good evening, everybody, to Dr. Carla and to the distinguished panel. My name is Pastor Walter Thomas Jr. I'm a pastor of First Baptist Church of Steelton in Harrisburg, Pennsylvania. Been pastoring here for the past 6 years now. I've been serving in ministry this year for the past 20 years. So I'm excited to be able to share in this conversation tonight.
Thanks, everyone. It's such a pleasure to have you all with us, and I just appreciate it. And we're going to get right into it because I'm sure people will have some questions that they would like you all to answer regarding what? Reopening. We are back. That's what they keep saying. We are back. We're saying it. We're back. You got to come back into the office, or some of us have never left the office, whether virtually or in person. So people's anxieties and concerns, of course, are, just going up and up and up because of what's going on. So there has been, just in general, since the pandemic last year, anxiety has been an issue. So I'm going to start with you, Dr. Hamilton. Do you see that this being even more of a challenge as people, have to go back into the office or go back to school or are asked to come and return to worship services? What are your thoughts, Dr. Hamilton?
Yeah, we have seen just kind of sky high anxiety in general related to this pandemic. But now as we plan to get back to school and to work and other things, we're seeing it even higher because individuals just, they don't know what to expect. They don't have all the information. And I think that the gains that we made in preparing to come back, we've gotten thrown off a bit with the Delta variant. So there's a lot of unknowns about that. And so we're seeing anxiety even further off the scale because of that.
Yeah, yeah, I would agree. How about Imani, in your setting, or where the people you come in contact with, do you see anxiety being on the uptick in that area?
Definitely, it's on the uptick. I didn't say this before, but I also have a learning center. So I work with children from ages 2 up to 16. So even in the children, just having to be conscious of their clean habits and doing the things they need to do. And then those who are school age, who this year will have to go back into a classroom. They're a little worried themselves. They don't want to get sick. So we definitely see it. And it is another area that we definitely have to deal with and manage and help children understand what they can do to kind of keep themselves safe and lower their anxiety levels. Because they have them even at 2 years old. They're definitely anxious.
Yeah, yeah. What about you, Pastor Thomas? How are you seeing it in the church and the community you serve?
It's interesting, Lady Carla. In the church, our church currently, we're still fully virtual with how we're doing ministry. And now we're making our plans, putting things in place to be able to add the in-person component to it as well. But we did a survey throughout our church, and persons were able to leave comments on the surveys as well. And so in some of the responses, you could hear some anxiety. There was one of the questions that asked, when you come back, will you have some precautions? And that had a large number of, or rather, was you looking for us to put some restrictions or regulations, what have you, in place? And that had a large number of responses. So those will be looking to make sure that we have distancing, that things are being cleaned, things of that nature. So the anxiety is there. And as Imani said, with the children perspective, the fact that they can't get vaccinated yet. And so one of the things I've noticed with my children is making sure that my wife and I, the way we talk about things around them, we're mindful of their response to it, their reaction to it, to make sure that their anxiety level doesn't get too high.
Yeah, that's a good point with the children and with us adults, that we have to be mindful of the conversations we have and realize that some people aren't as aware of what's going on as we think they are. And so some of our conversations could be alarming to people and increase their anxiety. So it's a matter of just knowing your audience and then just going in and diving in with the conversation and meeting people where they are. And that's in every area, medically, psychologically, spiritually. If we meet people where they are, then we can have these challenging conversations about, well, you got to come back to work at some time. At some point, you got to return to the office. You have to find a way to kind of, tell people, okay, the pandemic apparently isn't going anywhere, so we got to get back to doing some things. And that's where people find themselves. People are saying, look, I was ready to go back, but now the Delta variant. So with all of the things that are happening in our world, how can people adapt to the rapid changes that are now occurring almost daily due to the pandemic? And then we have regular life. Life in general is still coming at us, whether we're in a pandemic or not. So I'll start with you, Dr. Hamilton. What do you think how can we adapt?
So kind of some of the focuses that we're finding to be helpful in our communities is to try to bring folks back to the simple. Let's just kind of keep things simple and adapt by focusing in on kind of 3 areas. One of the things this pandemic has really brought into focus is priorities. Things that we used to think was very important before, we find that those things are not as important. So one of the first things that we try to get folks to do is focus on your priority. What are those things in your life that are most critical? Family, health, and those types of things. And then try to adapt your day, focusing a little bit on those 3 dimensions: mind, body, and spirit. If we would attend to those three areas, that would help us adapt and reduce our stressors. And so I can give some examples in mind, body, and spirit. But if we would attend every day a little bit in those areas, it would help us.
Okay, well, you can give the suggestions. It'd be great.
So
if you have some.
so one of the things that that is helpful is a rubric that we call Keep It Simple. And we use the letters from Keep It Simple. Number one, keep your eyes cast above. Pull down those spiritual resources that and promises that we know. Now, we know that not everyone has those types of connections, but for those that do, we say, keep your eyes cast above, Isaiah 26:3. E is eat for wellness. Keep an eye on what you're eating, the colors, the leafy greens, and those types of things. 1 Corinthians 10:31. Exercise regularly. In order to adapt, we got to move away from binge watching Netflix. And we don't have to go out and do much, but we can put the YouTube on in the house and do the workout, but we want to do some regular exercise. And then pray for the anointing. We need wisdom right now. We have a system in our community that is trafficking in and monetizing misinformation. Misinformation is very stressful. And so we need wisdom. And so we need to go to the source where we have wisdom. We have to mind where we're getting our information from. We've got to turn off sources that are just not giving us correct information. So we need wisdom. And then under the it, we want to initiate genuine friendships. One of the things that we've learned is that we can adapt when we have close connections. And we're talking about real, genuine friends, no judgments, people you can text or FaceTime or WhatsApp or those things, but developing and having genuine friendships is in order. And then under the T for it, tell the truth. When you're honest and forthcoming, that cuts the drama down in life. We want to do things in life that simplify to help us make these adjustments. Shut the drama off, be straightforward, be transparent about how you feel. It's always okay to be transparent. So we want to tell the truth about where we are. It's okay not to be okay. And so if we're struggling, let's be honest and tell the truth about that. And then under simple, S is start sooner and do less. You don't try to do so much. If we know we've got to be cross town, let's start a little earlier and maybe shave off something at the end of the day. And then involve ourselves in service. We're always better manage our stress when we're helping and serving others. We want to mind our mental state. Be aware that when we're down, be aware of what depression symptoms look like so that we can say, I'm down. I think this is more than being sad. And I don't know if this is a depression, but we want to keep an eye on when we're feeling different, kind of what questions to ask and the resources that are available to mind our mental state. And then we want to prioritize what's important, because if we say that family and health and life is important, then we need to make those things our priority and spend our time and our energy there. And then we want to love intentionally. 1 Corinthians 13, we need to love. It doesn't matter if we do all these other things, but we've got to love, and that will help us in our adjustment and managing our stress. And then lastly, enjoy, laugh, and play. We want to do things to keep us connected, to keep us kind of not being so stressed and focused and worried about the pandemic constantly. We want to do some things that we enjoy. So the keep it simple mindset can help us with some of that adjustment.
That's great. That's great. Now, Pastor Thomas, what suggestions do you have since things are changing so quickly for people to adapt?
Well, Dr. Hamilton gave a whole word.
He did.
She
That was
covered
good.
almost every area. But one of the ones that she touched on that when you talk about adapting is the one that really stands out to me is not trying to adapt to this new reality by yourself. So having some, whether it is one individual or a crew of individuals who you're sharing this with. Um, when church, we talk about having prayer partners. I would say for this reality we're living in now, we need pandemic partners or post-pandemic partners. Those who we walk with to help hold us accountable, those who we can lean on, they can lean on us, but together as we all learn how to navigate through this, I won't say a new normal, but the next normal. The pandemic, in the height of it, we really talked about how we were being separate and isolated. And in that area or in that stage, we had to learn how to connect without connecting. We had to learn how to use FaceTime, how to text one another, how to use social media for the good. We had to learn how to use Zoom and things like this. That now all becomes a part of this next normal. And having persons who we stay connected with, who we say at least once a week, we're going to talk to each other. We're going to connect with one another to see how we're handling this, because none of us have lived through this before. Not just a pandemic. The last one of this scale was 100 years ago, but none of us have now lived through what after the pandemic is going to look like. What things are changed forever, what things no longer the same, what individuals are now no longer here with us, and the grief that we now bear with that. And so don't try to do it by yourself would be my key or my tool, if you will, or my nugget I'd want to add for those who want to adapt to what normal begins to look like when we can define it, whether it be this year, next year, or the year after that, we begin to find out what normal is. I would say don't try and do it by yourself, because the weight of that will crush you. But find somebody to support you, somebody to lean on, whether it's a friend, a family member, or if you are reaching out to the Renaissance Center and taking advantage of what they have to offer there, get somebody to share the burden and the load with.
Yeah, I agree. Sharing that burden is so important, especially with all of the stress and strain that everybody's under. So that's great. What about you, Imani? What are your suggestions?
So, in listening to the Keep It Simple model, which I like, I look at how we work that with even children, because many of the things that you spoke about, we develop as we get older. But at our center and many of the childcare centers and within schools, you try to help children have routine, learn how to do things a little bit less and take their time and be at ease with what they got to do. So just working with the children and their parents who are anxious and worried about, well, what if my kid gets this? Just helping them to understand the protocols and how the normal everyday things we start doing right now as children can be the good habits we can carry on through life as adults, so that they can be better managing any anxiety, be it a pandemic or whatever happens in their life. That Keep It Simple model literally had many things that we do in our day-to-day with children to kind of help them even now just learn to be better adults as they grow older and give them the coping skills they need. And they sometimes help their parents. At school, they told me to do this. And so the parents do some of the same stuff where they talk about it. We encourage the children to express their feelings and be able to just tell us how they feel, regardless of the pandemic. But these are just strategies and things we innately try to do in childcare as well as with children in school. So keeping it simple.
Yeah, keeping it simple. So I hope, everybody got that. Keep it simple. It doesn't take a lot to take into consideration the things that you have. You already have the skills. You just have to remember to use them. Sometimes people say, well, I don't know what to do. Everything is so confusing, but go back to your basics, keep it simple. Just do, what you know to do that helped you in the past. And we forget we have skills that we've learned over time, or even new skills that we've learned to help us to be able to manage. And I agree. We just have to go with the flow and keep moving and keep it simple. So we know a lot is still going on with the vaccine. And this time last year, we were all hopeful that when a vaccine arrived, right, that our life would by now, a year later, be, returning to some normalcy, maybe not 100%. But as we see, people didn't take hold of the opportunity to be vaccinated once it was available in the number that we thought it was going to be accepted. So with that, with the people still being apprehensive about it, what suggestions do you have for those of us trying to encourage persons, and then again for those persons that are on the fence? And so I'm going to start with you, Imani, this time.
So I really encourage people to just continue to listen to those who are apprehensive. And if they're coming to you and confiding in you and you don't have the answers, help them find someone who can help them with their fears. Reach out to the medical professionals that you know, to the people who can help you understand the importance of getting vaccinated so we can get back to whatever our new normal shall be. We just need to begin to learn to help them to adapt to just for today. Stop trying to think about what's going to be a year from now and focus on what's happening right now. So just encouraging people to listen and reach out to persons who can help others with the answers that you may not have. But being that open listening ear is just the most important thing you can do, because people have true and real fears. They don't want to share it with the world. And so offering the opportunity to speak one-to-one with someone who can help them makes a big difference. And I've seen it happen many times. I've done many groups, and then I've done from the groups, people reach back out individually to get their answers, the questions to their answers to their questions done. And from that, many did go and get vaccinated. And they encouraged other people in their family to get vaccinated. So just keep listening and encouraging them to talk to the people they trust the most.
That's great. Dr. Hamilton, what are your suggestions? You're on mute, yeah.
Okay, I'm up there. This has been a challenging area. And one of the things that I've come to learn by one of my clients who actually does outreach here in the city, I've come to understand that those that are apprehensive for getting the vaccine, it's not a homogeneous group. It's different. Folks are apprehensive for different reasons. And she gave me some good insight. And I did ask her if I could share some of that with us tonight, because I thought maybe it would be helpful for those that may be running into these groups. She said, among the young folks, I don't want to say millennials, because who knows what the cutoff age is for that. But among the young, she said that she's finding that they have a sense of invincibility, like they're invincible. I don't need that. And so we have to maybe understand that's their mindset and kick out a little bit of information their way that might kind of put a dent in that mindset that they're invincible. And by that, we can just kick out information. Well, some of the most prominent and increasing deaths are among folks your age. And so just kind of giving them some information about youth and their age, and that they're not invincible. And there are increasing reasons why they might want to change their mind and consider getting vaccinated. Among some of the more seasoned members of our community, the apprehension is around kind of wanting to hang back. I want to wait and see how this thing goes with other folks. And so the question for some of our seasoned folks is, all right, now Sister such and such, you've seen how we all had the vaccine. What you waiting for now? What are your concerns? And so to better understand, they've been waiting to see how the vaccine is going to impact others before they make the decision. So for them, it is encouraging them. You see, the rest of us are doing well. Come on now, talk to your doctor and see if your health and stuff, it's a good time now for you to move forward to make that decision for them. The other thing is that we're finding that to break down the apprehension, some of the most effective things is to putting this sheet in their hand. People have to do their own research. They're not going to be moved. Everyone's not going to be moved by what somebody else said or being nudged. They really have to do their own research. And sometimes they don't know where to go for that. So we put this information in their hand. If you're local in the city of Baltimore, just hit that link and go out there and your questions might be able to answer. If you don't trust what's happening because they don't trust local government and they don't trust, certain things, I tell them go out here and hit the CDC site then. That's not even Baltimore. It's not even Maryland. And so when we have resources, put something in their hand in their own time and in their own way, they can hit that link when nobody's watching and do their own research to move them along in making their decisions. That's what I have found to be helpful.
That's great. What about you, Pastor Thomas? How are you engaging with those persons that might be apprehensive still about the vaccine?
One of the things I'm blessed, my local congregation is the majority of our membership who have interacted with us through our communications outlets are vaccinated. So that's been a good thing to find. But in our process of getting to that point, one of the things that we did was we did our best to elevate those voices of some of our local doctors and those who work in the healthcare system to get the accurate information to them. I would encourage us to encourage others to not so much go by the Facebook posts or the social media memes. Your uncle or your Facebook followers, they haven't been to medical school. But if you go talk to your doctor, or if you don't have a doctor, there are websites, as Dr. Hamilton said, every state has one, every city has one, where the government websites where you can get the right information and then make the decision for yourself. As the pastor, of course, I would say pray about it, but I would also say talk to your doctor to find out your best plan for your health. It is one of the things that has amazed me is we put so much stuff in our body. This is the first thing, at least in my lifetime, that has been so questioned. Folk take flu shots every year. We take Tylenol, Aleve. You go to the doctor, he says, take this Cillin or whatever it is. We don't ask what's in it. All we ask is, do you have the generic brand so I can pay less for it? And so now with this, because, it's been so politicized and what have you, we want to know who made it, where was it put together, what's in it, how that affect me, how does it deal? And some of it, has the historical background because of what has been done to people of color in the past. But this is not that. This is not what we've seen in the past. Nobody's trying to put a microchip in you. Just again, do your research. Don't let somebody else tell you what to do to decide what your health plan is going to be, unless it's your medical professional. It's not your friend, not your homie, but talk to the people who have been to school for this, and then you make the best decision. And then also realize this, that the ultimate end of what we're seeing with COVID, it's not just that you get sick, but that people have died from this. People have lost their lives. And so if you don't want to do it for you, do it for the life of your loved ones. Do it for those who are around you, who may be in a vulnerable community, who may have pre-existing conditions and what have you. So don't just think about yourself with this, but also think about those whom you love and how your decision will impact them as well.
Can I add something, Lady Carla?
Mm-hmm.
And on that note of doing it for someone else, we have so many who can't be vaccinated. So we want to protect our children. As a nurse, talking to other frontline professionals and knowing what's happening right out there, many of the children will get sick, and our hospitals will get overloaded, our nurses will get overloaded, our doctors will be overloaded. But if we just take the vaccine, get the information we need to get from our doctors, the research on the internet that you can find from the reputable sites, the CDC, the World Health Organization, and talking with someone, combining all of those things, it could just set us up for a better future so we can move past this place into a better place as soon as we do these types of things.
Yeah, I agree. You know, we have to take it one person at a time and sometimes have those candid conversations and just, you know, continue to keep the dialogue open so that they will at some point, you know, make a decision to hopefully get the vaccine. And I've seen that happen with some individuals that just having conversations with them over time, they have, you know, said, hey, I'm going to do it. And they've, you know, made those appointments, or, you know, it's walk-in now. It's not really no hindrance to getting it. So have patience with your loved ones and friends that might not be vaccinated yet, but just continue to be a voice and send them to people who you know they will trust, because again, they may not trust your voice, but someone else in the health profession they may trust. With everything that's going on, so we know that's a big concern with the vulnerable persons that can't, especially the children, and some people with certain illnesses can't get the vaccine. Have you seen anything else that's impacting the outcomes due to people's concerns for getting, you know, for going back to normal? So some other, like maybe some fringe things that are happening that aren't talked about as much since this push to return to normal or to reopen has been, you know, put upon us in so many different areas. So Pastor Thomas, I'm gonna start with you. Are you seeing anything else that's being impacted by this?
I would say the reopening itself has been somewhat detrimental, in that some took that to mean the pandemic was over. And so part of the reason why we see the numbers going up now is because even though places are reopening and some sense of normalcy, or what we call normal, seems to be on the rise, people stop wearing masks, stop social distancing, stop doing the precautions that kept us safe throughout the first part of the pandemic. And so that element, I think, has led to where we are now. It's part of the reason why now we see, you know, with the Delta variant, and how it is more contagious and how it is spreading the way it is. It's because we've let our guard down in a sense, and really felt like, okay, this was over. Now we can do what we want. We even see governors in some states who are saying, if you put a mask mandate in place, you're going to lose your salary, not get your paycheck, and things of that nature. When the truth is, we have the vaccine, that's good, but we need to continue to be diligent because we're not out of the woods yet, but we're still dealing with this thing. So I've been glad to see, for the churches that have reopened, that they've been diligent with at Morning Star, with wearing of masks, with distancing, with having certain requirements in place to go to worship, or regulations, if you will, when you're in worship. This is how we do things now. It's not just now everybody can come back in, take all the wheels off, but no, it's still, we're being responsible. And I think that's the key, that we've lost that sense of responsibility that we had from February 2020 all the way up till now. It has lessened, and now we're seeing that is one of, I guess, the fringe elements that has led to us now looking at another spike in this pandemic.
I agree. Yeah. Just taking something as small as saying, hey, you don't have to wear your mask has turned into a really big thing. First, you know, it's just the psychology of it all. So Dr. Hamilton, are you seeing any other things that are kind of a part of this reopening that is maybe a good effect or adverse?
Well, I don't know that it's necessarily related to reopening. What I'm seeing is this increasing kind of fatalistic kind of line of thinking. People felt like we were coming out of it. They were excited. We were wanting to move forward. And then Delta hit. And then all of the old isolating and other things, it's just too much for people to take. So they kind of want to throw their hands up and say, I can't do this all over again. If I get it, I get it. And so this kind of fatalistic kind of attitude, it's understandable. But I think that that's working against us as we try to now move forward in some ways. And therapeutically, the work around that is testing our thinking. We can have some mistakes in our thinking. We know that. That's why cognitive behavioral therapy is so helpful to help kind of guide and model. Come on now, let's model that. How can we look at that differently and kind of shift our mindset? So the fatalistic kind of, they're overwhelmed, this fatigue is what we're seeing. And so developing in therapy some approaches to help with that. We find is helpful. The other thing is that, we have to remind folks that what we fear, we bring into existence. And so we've got to not fear this thing in a way that we don't do the things that we know are helpful. And so to push back against fears, kind of take it head on, get out to your doctor, follow up on if you're getting treated for other chronic illnesses. We have people who have complex medical conditions that's not well managed, and their fear is keeping them back from going to the doctor and doing those things. So testing our thinking, pushing back against our fears, if we would do that, it would ease this general kind of move to help us all towards our reopening.
Thank you. We are open for questions. So if you want to put some questions in the chat, do feel free to do so that at the end, we can answer your questions. Imani, do you have any suggestions or things you're seeing that are happening at this point?
No more than what Dr. Hamilton and Pastor Thomas spoke about so far. I just think that, and in my line of work that I do daily with the children, just helping them, because they can sometimes lead the way, right? And so helping the children to understand how, well, this is what we have to do now in school, and we can do it, and we can still do the things that we want to do with some of our friends. So yes, there's the fear of having to shut down or isolate again. But for many companies, as we see, there are mandates for you to get vaccinated, or you might not have your job. But as people begin to go back into the workplace, as people begin to have to do that, they have to bring their children to a place like childcare or school. And so just helping the kids to just understand it's okay to be able to wash your hands and spread your arms out and say, make sure you're not touching your friends all the time. And just helping people to understand we can get through this and we can get through it together. Even if it means we have to go back to doing Zooms or more those social media type of things. But for those who are in person, we have things in place that help us prevent and lessen the risk of anyone getting sick. At Morning Star, I've been called the COVID police many times. And that is just to make sure that, because people's spirit needs to be fed, and we want people in the sanctuary, but we want them to know we're doing everything we can to keep them safe. So, and that's what we do, as well as in places like childcare. I'm telling you, when you see the kids do the things they do or sing the songs they sing about cleaning their hands, and some of this is our normal stuff, those things help to reduce and lessen the anxiety. It makes it a little bit easier for people to feel like we can reopen. It may not be what we thought it would be, but we can still do some of these things, and we can still interact and be around each other and people. But we just have to do it in a different way than what we're used to. So adapting to the day and not looking at next year or next week. It's just so important, and just trying to just be in the day and help the children and adults to get to that place.
Yeah, I think that's a good point. Just being in the moment, being in the day, and not, projecting too much into the future. and again become apocalyptic and think, and you're thinking that the end is here, the end is near, and all kinds of other conspiracies or ideas that are going out. So that's a part of it. And I know we mentioned a little about the safety protocols, and I'll start with you, Imani. Are those things that we've been doing, do you feel like they'll be around for a while, as we reopen, even say if we get to 70-80% vaccination rate?
So I do believe people will have a higher consciousness of what it means to um, be clean or cleanliness, and just taking care of themselves. Because as we saw last year, when the numbers started to come down for COVID because we wore our masks, even when we didn't have the vaccine, we also saw the flu coming down. So you just started to see, okay, this is not so bad. Maybe I wear my mask in the wintertime because it helps reduce colds. It's reducing flu. So some of those things innately people are just going to want to do because it's just helping you to stay healthier and be well. But ongoingly, I think the cleaning of your hands, how you cover yourself when you're sneezing and coughing, those things are innately things we've already done, but we'll just have a higher consciousness of doing them now. Because even as we move through this pandemic, there's always something new that may come our way, and just continuing those good health habits will just inevitably be the best things we could do all the time. So yeah, those many protocols will be in place, but they may just be self-imposed because you get used to them and you see the benefit of just doing things that help you stay safe.
Yeah, I agree. What about you, Pastor Thomas? Do you see any uh, changes coming down the pike? Like you said, you're working to reopen. So are you gonna have some safety protocols, in your congregation?
Yes, it's non-negotiable. The
Mhm.
membership is looking for that, and so even when we're not basing ours on what the CDC says, or rather, their recommendations for us are the baseline. We want to make sure that what we do is we go over and above that. So our membership is guaranteed that they fully trust that we're doing what we can to keep them safe. So even when they said, if you were vaccinated, you didn't have to have a mask indoors, our plan was always masked indoors, vaccinated or not. And so we want to make sure our protocols even exceed what they say. So I think those things will stay in place at least for the foreseeable future. When as Amani said, when the flu went down, we all began to see, wait a minute, this isn't just stopping COVID. This is helping with all sickness and disease. We laughed at Michael Jackson years ago. He was on to something, wearing that mask when he was going out in public. So I said, okay, this type of stuff can help, and many of us see the benefits of it. And I hope we begin to see it going into the future as well. But I would add on to the protocol piece also the best practices that we've learned in the pandemic. I think those will remain. When I talk about First Baptist now to people, I tell them that we are a virtual ministry that is looking to add an in-person component. So we're no longer an in-person ministry that is on pause. Like, no, we are a virtual ministry. That's what we are now. We're going to add on an in-person component. That's what we're working to do now. But we're not going to stop doing virtual because of that. We're not going to lessen virtual because of that. As a matter of fact, the reason why we're not open now is because we want to make sure that in-person does not hamper our virtual, because virtual right now is our number one campus, if you will. And so the things that we've learned from that, as far as say online giving, different ways to do ministry functions, outdoor missions and things like that, those best practices will remain as well as a part of our ministry life from here going forward.
Yeah, that's excellent. I like how you say some of the lessons learned during COVID, we can go forward and build on those. So everything hasn't had a negative impact. Some things have happened that we've had to adapt to that have helped us grow. I want to give you this question, Dr. Hamilton, that came in our chat. Someone said that they feel like some of the medical doctors are fearful of treating their regular patients. And so when people are calling in with concerns, their doctor isn't as attentive and, maybe dismissive. I mean, have you seen that, like the anxiety of the doctors is affecting their care of?
And
person?
so, we do clinic work. We're right in the neighborhood, and we never closed our doors. There was always at least one or more clinics available for folks to come in. So throughout this whole year, you were able to come in and see a medical doctor. It has not been my personal experience to see our physicians be a little hesitant. Now, I don't take that experience away from the person asking the question. If that's what they felt, that's what they sensed, that's what they sensed. I would say that doctors, medical staff have gotten a little bit more confidence, I think, because we have to temperature check in every day. We have to mask up over all of those protocols, the hand washing, we have to consistently do. And I know that medical doctors are doing that. And so for the patients that are coming into the clinic, also have to be temperature checked in. There is also a checklist for if patients are coming in. And so medical doctors should be pretty confident if there's a patient in front of them that their exposure, they're not having direct exposure. The other part of that, I would say, is that we saw as a part of this pandemic, the rise in telemedicine and telehealth for those who are not comfortable coming in, whether it's a doctor seeing patients in person or the patient wanting to do that. And I don't see that changing. I think as with the virtual ministry, telemedicine and telehealth is with us to stay. And so I'm hopeful that if the medical staff that this individual is referencing has some hesitation, that medical staff member has gotten more information and can feel more comfortable working one-on-one in person with their patients. Our doctors, they're shielded, they have the mask, they're temperaturing in, a lot of protocols every day is in place. So I want people to feel comfortable coming in person. If they choose to do that, that option is available, or they can opt for a telehealth appointment.
Yeah, I'm glad you mentioned the telehealth, because that is how some doctors and other clinicians are seeing their patients. And so maybe that could be a part of it. If that's you want in person, but the person isn't offering it at this time, or maybe your symptoms don't seem like you need an in-person visit. So what I would do, in the case if I felt my doctor was unresponsive to my needs, is of course tell the doctor, like, look, I've been calling you, for the last 3 months with these same symptoms, and you're like, oh, you'll be good, just take Tums or whatever it could be. And that's not, what the kind of response you're looking for. And remember, you can always change doctors. I mean, we think that we have to have the same people, throughout our lifetime. So this might be a sign for that person as well. Hey, it's time to maybe look for a new primary care physician or get one, because we notice a lot of people don't have a primary care and they use the ER and urgent care as their source of health care. So
yeah, can I add something on that? That's really is important. And I've got to say, you have to always be your best advocate. And it's incumbent on that medical doctor to not put that sense out. It's incumbent on that medical doctor to actually reinforce confidence in their patients that they are safe and the protocols that they see are safe. So if I continue to get that sense from my medical doctor, I would be looking for another doctor.
Yes, yep, and that's, I think a lot, like, again, we're not used to making these shifts, but I think that's what we've seen the pandemic just bring to light, that some of the habits, relationships, and ways of doing things that we have become accustomed to, we can make changes, and changes for the better. So all of the changes that have taken place have taken us in different ways, mentally, physically, and spiritually, but it's okay. So don't forget to put some questions in the chat, and we're gonna close out with this one last question. As we know, people are re-entering, and just like I said, we can find a new doctor if necessary. Um, I've heard that people are quitting their jobs, they're quitting their relationships, they're like quitting everything. That's their response to what's going on around them. So as people though are returning or getting a new job or having other new experiences, is there something people should do, or what should be on their checklist? We heard what they should expect from their physicians. We heard Pastor Thomas say what he's doing at his church, and Imani and her facility. Is there anything else people should be aware of that might help them in that transition from being at home, working from home, to working back in the office, or even doing your own grocery shopping again? I noticed that they cut back the hours for the senior citizens at was it Costco or somebody, and then it was an uproar. It was an uproar. Like the seniors are like, we need our special hours back. So because it was an uproar, they changed the hours back to those special shopping hours. But I'm just saying, so some things that people got used to are no longer with us. So what are your thoughts? How can we adjust? Imani, I'll start with you.
And so I would just say that some of the things that people should do is be aware of what they really feel. If they're just going back to work, or if they're just going back wherever, just be really in touch with your own concerns, so that you can then ask your job or at your church or wherever you're going. If your child is going to a new childcare facility or school, find out what they are doing and what their protocols are. Many times, as Pastor Thomas said, the CDC guidelines for many of us who are up and going are the baseline. Many of us go beyond that because we know we need to, for our own safety and for the safety of those who can't be vaccinated as well. So just really be aware of your own fear and concerns, and be willing to ask what is in place, or talk to your employer or the school about those things, so you can educate yourself to know what is happening and what they're doing to help make sure you're safe and that your children are safe. It's just really being in touch with what you really, really feel about where you are. Because in order to live, we got to keep moving, and you got to get outside and do some things. You cannot stay inside. And if anxiety is one of those things, add a new person in your list of people to see. Because if you're not usually seeing a therapist, find you a good one. Go talk to somebody, because your fears and anxieties are real, and you have to deal with them so that you can move on and move forward and be more productive and do the things you need to do. So.
Thank you. Pastor Thomas, what are your suggestions for people that might be apprehensive re-entering, like we said, schools, work, worship?
I would say don't be shy about sharing your comfort level. While we all are going to these same spaces, we all have different comfort levels. One of the things a pastor friend of mine told me that they did at his church, and we're going to incorporate this at ours, is they had a wristband system, of red, yellow, and green. And so for those who come to church, if you are, vaccinated, but you want folk to keep their distance or what have you. Or if you're coming and you still want people to keep their distance, you wear a red wristband. If you are fine with, the fist bumps and what have you, or elbow bumps, then you can wear a yellow wristband. If you are, hey, give me a hug, then you wear your green one. But we know everybody has a different comfort level. And so don't feel like just because everybody else is fine with hugs and being close and you're not, don't be ashamed about that, because you feel what you feel. And whatever your level of comfort or ease is with this, that is another part of your mental health. And that's what helps keep you, I don't know if I should use the word sane, but I would say in your right mind. It helps to keep you comfortable and relaxed, if you will, that this is, I've got a bubble. Hey guys, I want you to know I've had a bubble. Please respect my bubble. And you may feel how you feel about it, but this is how I feel. I can work best. I can serve best. I can worship best if you all know how I feel and we all respect each other's feelings about this. So I would say share that with those who are around you in whatever space or setting you're in. And one other piece I would add on is not so much in the same line of it, but when you mentioned about going back out into places and what have you, I would just also add, if we could add an extra level of patience and respect for those who are in the service industry. When you mentioned the unemployment piece, my wife and I have had a chance to go out to a couple restaurants. And one of the things we've noticed everywhere is that they're short-staffed. Persons have not come back to work. Hours have been reduced and changed. And so just please make sure that we're extra patient, extra kind towards those who are in those positions, because they're doing extra work. Some of them have increased pay, but everybody hasn't. And so that's another added level of just, again, this new reality we're living in. So I just wanted to add that piece in as well.
Yeah, that's a great point, that the short staffing at just about every establishment, whether you're an auto repair shop, it's across all kinds of, even therapists. It's a short staffing of therapists and other mental health professionals. So yes, be patient with each other, and that's a good practice. And even in returning back to work, we need those wristband colors at work too. Look, don't come in my office. You see this red wristband. Sorry. But anyway, Dr. Hamilton, what are your thoughts? We have some great suggestions for people to re-enter into certain spaces. Do you have any closing thoughts?
You all have covered so much of it here tonight. I love that. I want a wristband on each arm. I don't know. I'm gonna double
I'm
down
with my
on the
Wonder
wristband.
Woman or
I'm gonna do
Wakanda or
that.
something.
Is it? Yeah, that. No, I would simply say, this is a new ball game. Um, I would encourage folks to stay open. Stay open for change. Stay open to maybe reimagining how you used to do things. Stay open to maybe learning something that you've been a little bit hesitant. The way we used to go about our lives there's not one aspect that has not been touched by this pandemic. And so I just want to encourage folks to stay open to learning something new, considering something new, developing another and improved in a better way. Not be afraid of what life has served up for us, and to step boldly, be confident, use your resources, and be open to learning new modalities for how we live our lives, whether you're ordering your groceries, whether online, or whether you now work primarily at home but come into the office some days, whether you would be open to telehealth appointments with audio or the screen. Just be open for a new way of engaging our lives. And I think that will bring down the anxiety and open us up to new opportunities to be even better as we move forward.
That's great. You really summed it up for us, Dr. Hamilton. Just be open. Things are changing. They have changed. And look, we've adjusted for the past several months, and we've survived. So just be open. Remember to stay in touch with your comfort level and be okay sharing it with those around you. They want to know how you feel and they want to make you feel safe. And we want to stay safe and we want to keep the conversation going because that's how people change and grow. So we appreciate you joining us this evening for this conversation. As the world reopens, we need to know how to get along and do the things that we still have to do. Life hasn't stopped and we still have things to do. So we just have a new way of doing them, and that's okay. So I want to remind you that the Renaissance Center has 2 free sessions for Baltimore City and Baltimore County residents. You can call us at 410-409-0025. Also, we take various employee assistance programs as well as insurance plans. So there is no reason for you to not get the help that you need. So again, I thank our guest, Imani Rose, who's our expert, one of our experts at Morning Star. So we thank you for your time. Dr. Lene Hamilton, a clinician and in the community, and we thank you for serving in the community and in your own private practice. And way out of Pennsylvania, but thank God for Zoom, is Pastor Walter Thomas Jr., who is making those adjustments and making it work and encouraging his congregation and community to come alongside and join the community at large and growing and being who we are all called to be. So thanks, everyone. Thanks for joining us.